Who is the lover?
Allah.
Who is Ar-Rahman?
Allah.
Who is Al-Mannan?
La ilaha illallah, Muhammadur Rasulullah. Muhammad is the messenger, to Allah is our return. La ilaha illallah, Muhammadur Rasulullah. Muhammad is the messenger, to Allah is our return. La ilaha illallah,
Muhammadur Rasulullah.
La ilaha illallah,
Muhammadur Rasulullah.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم والصلاة والسلام على أشرف المرسلين سيدنا محمد صلى الله عليه وسلم وعلى آله وصحبه وسلم. الحمد لله الذي أنزل على عبد الكتاب ولم يجعل له عوجا قيما لينذر بأسا شديدا من لدنه ويبشر المؤمنين الذين يعملون الصالحات أن لهم أجرا حسنا ماكثين فيه أبدا. أشهد أن لا إله إلا الله وحده لا شريك له وأشهد أن محمدا عبده ورسوله. اللهم صل على سيدنا محمد وعلى آله وصحبه وسلم. Amen. My dear brothers and sisters in Islam, Assalamu alaikum wa rahmatullahi wa barakatuh. That is, may the peace and blessings of Almighty Allah be with you all. Amen. You are welcome to yet another edition of our program tonight, Islam in Focus, a production of the Muslim Media Watch Group of Nigeria to educate you more about the teachings of Islam and how to live a very worthy life. Today, we are going medical. As I told you that occasionally we'll be coming with medical experts to educate us on how to live a healthy lifestyle. I have with me in the studio today a consultant, a cardiologist who is an expert in the area of medicine. So join me in welcoming our brother in Islam, Dr. Rafiu Adefila. Dr. Adefila, assalamu alaikum wa rahmatullah.
Wa alaikum salam wa rahmatullah.
You are most welcome to this program.
Thank you very much, sir.
You have been invited today for the first time to discuss a very important topic. When you ask people in the society today, some of the ailments that are common in the Nigerian society, or even in the whole world at large, they talk of hypertension, cancer, diabetes, even hyperlipidemia, that is obesity, and many other ailments. Tonight, because of time, we are going to focus on diabetes only because we have seen some of the negative effect of it in some of our patients and some of our relations, and we want to be guided about it on this Islamic program. What is diabetes?
Thank you,
And
sir.
how can it be prevented?
Thank you very much, sir. Assalamu alaikum wa rahmatullah.
Wa alaikum assalam wa rahmatullahi wa barakatuh.
Diabetes is a chronic medical condition.
Mm.
It's mainly diabetes is mainly elevated blood sugar. The main cause of diabetes is that the hormone in the body responsible for regulating the blood sugar, insulin, that is produced by the body to mop up the blood sugar, especially after our meals, is either not being produced enough or it's not doing its work properly. So eventually patients have elevated blood sugars. This will lead to complications that are very serious, that are very known to most of us. There are two types of diabetes mellitus. We have the type 1, which is commonly seen in younger people, especially people before puberty. And this type is actually mainly due to lack of enough insulin in the body. Whereas we have the type 2, which is more common, affects more people. Is seen in young to middle-aged adults and even elderly patients nowadays. It's mainly due to inability of insulin to perform its function of mopping blood sugar so that the body can use the sugar. The causes of diabetes are some particular lifestyle, like sedentary lifestyle, less activity, people always sitting, not moving around, maybe because of their nature or because of the job they do, they don't move around a lot or exercise. It's a major risk factor for developing diabetes. If people are overweight, that is, their weight is much, or they are obese, they're on the big side, it's also another risk factor for diabetes. Also, as we age, the risk of developing diabetes is also high. It's understandable that also as we age, we may be less active and all that. Also, sometimes patients, especially our female folks, during pregnancy, they may have elevated blood sugar, which we call gestational diabetes, diabetes in pregnancy, that most times will resolve after delivery. But it's a risk factor for developing diabetes later in their life. Some also patients that have hypertension, especially long-standing hypertension, also at risk of developing diabetes later. So these are some of the common risk factors that predispose people to developing diabetes.
Thank you very much. Listeners, if you are a regular viewer of this our program, you recall that Professor Ibrahim Adeola Katibi, one of the outstanding professors in medicine that we have in Nigeria, who is working with the University of Ilorin and the University of Ilorin Teaching Hospital, had educated us about hypertension. And that is why we felt we should move further, that long hypertension, what could it result into, even if it's well managed? Those who are managing hypertension for 10, 20, even 25 years may later develop diabetes. That's what doctor has said now. Might not, but it is a risk factor. It's one of the causes, like all other areas that he has mentioned too. Now, diabetes has been discovered in a patient. How do you treat it, doctor?
Thank you very much. Diabetes treatment is focused on two things. One, we must make the body produce enough insulin to help up the blood sugar, to help us mop it up so that the body can use the glucose for energy. Or we can also make sure that whatever insulin is produced is able to do its work. So medications that are used to treat diabetes that will be written to patients by the various doctors that treat diabetes in our environment are mainly to address these two. However, beyond the various types of medication, patients have to imbibe some serious lifestyle changes. Topmost there is diet. Diet of the diabetic patient is still a balanced diet. We are not sentencing patients to intake of beans and unripe plantain
And a kuru.
and all sort of bean products. No, it's still a balanced diet.
Okay.
Rather, we don't want the carbohydrate component to be more than half of whatever they take per meal. Also, we prefer they take lower quantity of meals. Preferably, it could be frequent but lower quantity, but still a balanced diet. So this lower quantity is better for them. And we don't want them to also take these meals later than between 6 to 8 p.m.
Okay.
So smaller quantity of meals, not late meals, balanced diet is better for
and
patients.
Exercising.
Yes, the next one should be exercise.
Okay.
Now the exercise, we need to put some guideline here.
Okay.
Yes, our people know that doctors mention exercise. Say, okay, this exercise you are saying, is it enough?
Will I be jumping?
I come to work every day and I work from morning till night.
That's it.
We tell them no. This is a purposeful exercise, a purposeful activity. One of the guide for patients should be that whatever you do as exercise should make your heart race. or make you perspire, that is sweat. So it's going to be dependent on a lot of factor.
Okay.
One depends on the age of the patient,
Okay.
how strong the patient is, have an issue, like our fathers that will be elderly, or they may have other illness that may limit them already. So the type of exercise will be individualized depending on the person. Yes. So for somebody that is young, may be able to jog, swim, even do bicycles. For somebody that is elderly or with arthritis, may not go beyond walking around the compound and all that. But we want the exercise to be at least 30 minutes every day.
Okay.
For most days of the week, preferably at least 5 days a week.
Doctor, there are some of your patients.
Thank you.
There are some people who are diabetic patients, but who ignore some of these medical dictates that you give to them. Some even ignore to the level of not taking their drugs religiously.
Yes.
What's the implication for it?
Yes, diabetic.
The implication of that is what we want to know.
Yes, diabetes is, as I said, a chronic disorder. Most times patients don't feel anything, but when the sugar level is very high, that's when patients start getting things like excessive urination, excessive drinking of water, weight loss despite eating enough, or sometimes they already present with complications. Complications like blurry vision or even impaired vision and even blindness. Sometimes they may have wounds that don't heal on time, especially in their lower limb, that may necessitate their legs being amputated. This diabetes is a no risk factor for stroke. It's also a no risk factor for heart disease, including heart attack and heart failure. So it's also one of the major risk factors for kidney disease worldwide. So when patients don't take their drugs and they don't imbibe the necessary lifestyle modifications or advice we've given, those are some of the complications that could come up, sir.
I see. We should try as much as possible to avoid this situation. Viewers from wherever you've been watching this program, it's been your program Islam in Focus, and we are not yet done. We are still on the program. With me in the studio tonight is Dr. Rafiu Adefila. He's a cardiologist of the University of Ilorin Teaching Hospital and of the University of Ilorin. Now, what the doctor is telling us now is that in the past, there are ways we treat diabetes, hypertension, and some other ailments. But now with modern medicine, a proper way of treating ailment has emerged long ago. And technology, as well as scientific development that has been taking place in the society, has improved the welfare of the people, that managing hypertension, managing diabetes and other related ailments, you can even manage it to as long as 90, 100 years if you follow the rules. Now, there are some people who now listen to non-medical doctors, but friends or family relations that, why do you concentrate on drugs? This is modern drugs. We have local apps, including the new herbalists that are coming up through social media, through radio, and even all sort of ways that purchase this liquid and continue to take it. Purchase this capsule. They are not from your regular doctors, but their own works better. Please admonish us on the implications of all this.
Thank you very much, sir. Yes, we jokingly call them our competitors.
Okay, you refer to them as your competitors.
Yes.
Okay.
The truth is, we are a civilized society. Whatever patients are going to use for whatever illness should go through regulatory approval. Before regulatory approvals, these products, medicinal products, will be tested by the appropriate regulatory agencies. So what we used to say is, so far, whatever medications, be it herbal or orthodox, is being given to you, are you sure this is being approved or it has been approved by the appropriate regulatory agencies in Nigeria for the particular conditions that whatever the person that is selling to you is saying it is? If it is not there is no reason why you will use some such product for what? Treating diabetes. Because if you use them, the implication is that one, they may tell you they lower sugar. How effective do they do this? What are the other complications you can come up from them? Because we can have products that they will tell you the good side, they don't tell you the bad side, right? They will tell you, oh, so thing can lower sugar, but they don't tell you it can cause kidney disease or liver disease or side effects. You don't know any of such.
Whereas in your own modern medicine, you know it causes some of these diseases,
Yes.
but the cure of the diabetes that you are pursuing is going to treat it, and even if it causes all those things that they are saying, it may be later in life.
No, even at that, drugs go through every medication that we use for diabetes and other chronic or other illnesses.
Other illnesses, okay.
They go through several phases of clinical trials, and after that, when they are being used in the community, the companies and the regulators still monitor the populace to see what are the other new things that people develop with use of these drugs. So we don't have them with these non-orthodox medications for now. We it's not that we can't discover new drugs.
Okay.
We can discover new medicine. We can even discover locally effective medicine. But we must put them through the appropriate regulatory approvals and processes.
Thank you very much, Doctor. Finally, we want to round up this program. I want you to admonish our viewers, both Muslims and non-Muslims who are watching this program, how to take good care of themselves. Because the issue of medical screening every 6 months or once yearly is also very important.
Yes.
So please advise us on this.
Thank you very much.
I'm happy you are a cardiologist. You can also talk to us about hypertension too, so that people know what to do. Those who are on medication, how religiously they should be taking their drugs.
Thank you very much. Yes. Let me start by saying that for prevention of diabetes or developing hypertension or cardiovascular disease that mean cardiovascular disease are things like stroke, heart failure, heart attack, kidney disease, and all that. We have to live well. We are in the age of urbanization and technology. We tend to be stressed, but we are not active. We tend to take more of processed foods and all that. So nowadays, almost everybody has one or two cases of somebody collapse suddenly and die in the office or something like that.
Few weeks ago, a very top official of customs died while doing presentation in the National Assembly. So that's the type of case you are mentioning now.
So for the genetic risk factor, things that we don't have control over. We don't. Maybe your family has a history of hypertension or diabetes and kind of runs in the family. The only thing you can do is to take care of the things you can control, so that you delay the onset of such things like diabetes or hypertension. So by that, the major one will be lifestyle changes. So we have to move more, quote and unquote. We have to move more. That is, we have to be active. By activity means we should exercise, as I said earlier. So even if you are the busy type, you must create a time daily or most days of the week to exercise, depending on what is available to you and all that. Next thing, we have to make better choices with what we eat.
Okay.
Reduce the amount of calories we eat, avoid the processed food as much as we can, reduce intake of sugar sweetened beverages that we all know.
And sugar itself, whether in the tea or in the
we have to
pap.
We have to reduce sugar.
Okay.
Very important in all the forms.
Can we just eliminate it and use honey? Or some people will say honey and sugar, they are the same. Are they the same?
Yes, honey may have some other health benefits, but in the context of reducing sugar, you can't use honey like sugar and say because you are replacing something that is said to have other health benefits, I should just use it to sweeten my tea the way I used
Okay,
to sweeten
okay.
it with sugar.
So honey is good.
Honey is good, but you still cannot use it indiscriminately.
Okay.
So, especially if you have risk for diabetes now, you now say, okay, because you say honey is good now, I used to take 5 cubes of sugar in my tea, so now I will take
Two spoons.
half cup of honey or something
no,
like that,
no,
so
no.
that it will be as sweet as sugar.
That's an
You're going to
abuse.
put yourself in trouble.
Okay.
Exactly. So honey does not substitute sugar for somebody with a sweet tooth, for example. So we still have to reduce sweet things generally. Plenty of fruits and vegetables in our diet. Reduce the quantity we eat and all that. Next, we have to avoid smoking.
Okay. Okay.
Both smoking actively or even the passive one, second-hand smoking, that is staying close to people that smoke or the environment that smoke.
And even sniffing
Tobacco, yes. So we
of
have
tobacco.
yes, we have to avoid those.
Okay.
Next, we have to know our numbers.
Okay.
So I like using that terminology as we have been taught.
Okay.
That you should know your numbers. That means you should check your BP regularly. You have to know what your BP says. You have to regularly check your blood sugar. So we have to also check your blood cholesterol as a way of living healthy.
Okay.
Yeah, so you have to check your blood cholesterol regularly. So 6 monthly or 1 year, depending on your risk, you should do that regularly. So I think when we imbibe all this, even if one has a genetic or family history of risk factors, it's going to slow or delay the onset of such. Or if you don't have that, then the chances of you developing some of these risk factors or cardiovascular
Are
disease
eliminated.
will be significantly reduced.
Thank you very much. Viewers, it's been your program, Islam in Focus. And today we'll dwell on diabetes. Our medical scientist who is with us today is Dr. Rafiu Adefila of the University of Ilorin Teaching Hospital and of the University of Ilorin. And he has educated us very, very well on diabetes. That it could be generica, but the best way of preventing is to ensure that you live healthy life. In which way? Ensure you do your regular test to know your number. Doctors know the limit that you should get to before they ask you to ensure that before they confirm that you have diabetes. And when you are confirmed to have it, they put you on drug and they tell you what to eat and what to do. So this has been explained: exercises, balanced diet, and not too much sugar in your meals. So as we're about to round up this program, I must let you know that this your program is on YouTube, and we're also on website. And you can also reach us by mailing us on muslimmediawatchgroup@gmail.com. So our past edition of this program could also be watched on the YouTube. Join us every time to watch this program as we do it, or peep into the YouTube by liking our program and subscribing to it. You will continue to benefit. The Yoruba edition of this program will come up much later as you stay tuned to our program every week. On behalf of my colleague, Dr. Rafiu Adefila, I say Jazakumullah khairan. We'll be calling you again by God's grace to explain more to our people on our health.
Thank you, sir.
Together with him, we are saying, Wassalamu alaikum wa rahmatullahi wa barakatuh.
Allahu Akbar, Allahu Akbar, Allahu Akbar, Allahu Akbar.
All praise is due to the one and only. He is the master of all creation.
All praise is due to the one and only. He is the master of all creation.